Hello and welcome to financialexpress.com. I'm Sushmita Pan. Cancer is one of the leading causes of death worldwide, and India is no exception. The WHO ranking places India third in number of new cases per year worldwide. ICMR has predicted a possible 12% rise in cancer rate in India in the next 5 years. On the occasion of World Cancer Day, today we have with us Dr. Piyush Bajpai, HOD and consultant, medical oncology, Manipal Hospital, Dwarka. Dr. Bajpai, welcome to financialexpress.com.
Thank you, Ms. Marna. Thanks for inviting me over there.
So, first things that I would really like our viewers to understand what is cancer, like how it develops inside the human body.
So, cancer is basically the cells, a group of cells which have gone, a bit awry or anarchic. They are a part of our body, and they develop certain genetic changes. And these genetic changes basically they cause these cells to multiply, and they form basically then a tumor mass, that is a cell mass which is called a tumor or a swelling in other words. And this particular tumor starts compressing the normal organs and starts causing symptoms. So it can manifest as a tumor or a lump or a swelling, either of it. So this is what is how solid tumors present. However, blood cancers, they would present by increase in white blood cell count, or increase in platelet count, or increase in hemoglobin. So there could, or a fall in either of the three what I mentioned. So this is how cancer develops, by mutations in the cells.
According to you, Dr. Bajpai, what is the current status of cancer in India?
So the current status of cancer in India is we are seeing approximately around 12 to 13 lakh cases per every year. Uh, New cases are being diagnosed. These many new cases are being diagnosed, and start prevalence is nearly around 26 to 27 lakh patients would be there in our country at a point of time. So these patients, these cases are supposed to be, projected higher in coming times, for the reasons that India is a developing country. There is adoption of a lot of Western lifestyle, a change in lifestyle pattern, what it was urbanization, in other words, and therefore, because of which a lot of cancers, which are health lifestyle related cancers, are going to increase. Another cause of increase or rise in this trend is because of the better understanding and awareness of this disease pattern, for which people would now come forward to get themselves screened, and or any other symptoms they would present more and discuss more because of the awareness being generated. That is a positive move, but most of the times we see that the one of the major causes is urbanization and the adoption of Western lifestyle.
So, in the recent years, there has been a rise in non-communicable diseases. And as you mentioned, some of the causal factors, could you please elaborate more on how cancer is caused? And what is the percentage of, in India, we have various factors that leads to cancer. What is the ratio of genetic and external causes?
So, as you rightly said, non-communicable disease, cancer is a non-communicable disease. And this is one of the important myths that the society, this is there, that is it communicable? Can touching someone, I can get cancer? So one must understand that it is a non-communicable disease. As I said, that there are certain factors which are under your control or which are not under your control. So these factors majorly, fortunately, in cases of cancer, what we see that nearly 50 to 60% of cancers are because of lifestyle related cancers, which could be obesity, which could be diabetes, which could be gain in weight, so or which could be probably some viral infections, as in hepatitis or human papilloma viruses. So these are basically certain preventable factors which can be reversed when timely action is taken. And then you pointed out towards a genetic component of it. Yes, there is a genetic component to cancer, not all cancers, but yes, to certain cancers. And fortunately, this is actually less than 10%. So there is a genetic component in terms of the transmissibility from our parents or from the running in the family. So, but then the chances it would be less than 10%.
So, as we are aware that there are various types of cancer. In India, what are the most common types of cancer?
So the most common types of cancer, I would want to divide it in females and males. So in females, what we see that there is a rise, and the most common cancer being breast cancer because of, as I said, urbanization, uh, increase in weight, adoption of Western lifestyle, uh, late marriages. So there are certain reasons why breast cancer is increasing, uh, decrease, breastfeeding, decrease in habits of breastfeeding. So these are certain factors. The second common cancer in females is CA cervix, and in males, it's actually lung cancer and oral or tobacco-related oral or oropharyngeal cancers. So these are the common cancers in males. Also, then there are gastric cancers, which is common both in males and females, which ranks somewhere third or fourth in various cancer registries. Uh, the other cancers which are common is like colon cancer, which is coming up in India.
So, as you have mentioned that colon cancer is coming up, uh, with respect to these various types of cancer, has there been any decrease or increase in the recent years?
As I said, that there has been a shift in the breast cancer incidence in towards a positive numbers because of what I said, that there is more urbanization and the lifestyle involved. And then likewise in lung cancer also, because of increase in smoking and uh, passive smoking, which is also an important aspect, there has been an increase in lung cancer, and uh, there has always been an increase in tobacco-related cancers all this while because of the more, awareness about cancers coming up and people reporting. Also, there is prostate cancer in males. I would want to bring that because of more diagnosis, we are now diagnosing more prostate cancers and the numbers are increasing. So these are certain cancers which have showed an upward trend. Some good news is that now in metropolitan cities like Delhi, we are seeing that there is a stage shift. That is, we are now seeing that the cancers which were earlier being detected at a later stage, in stage 3, now we are seeing more of early stages of cancer. So there is a stage shift in terms of breast cancer. So certain cancers are now being diagnosed relatively early, and that's a positive thing in terms of treating these patients.
Talk about Bajpai, how cancer is diagnosed and what are the various ways to screen a cancer?
So cancer can be diagnosed basically a patient or a person has to be aware about any new changes happening in the body. These are called red flag signs. So anybody having any lump in the body, any increase in swelling in the body, any change in uh, color of the mole, or any wart being changed, or any ulcer which is not healing inside the mouth or elsewhere, uh, any bleeding, abnormal bleeding or discharge coming. So that all these signs need to be brought into the notice of the doctor. Then there is some nagging cough, or chronic gastritis, I would say. So people would keep on taking the oral
Mhm.
PPIs, that is the pantoprazole and Diogenes. But if they still have this gastritis persisting, one must bring these things in the notice of the doctor. Postmenopausal bleeding is another one situation which should be brought in the notice of the doctor. So if these red flag signs are there, and the person presents immediately to the doctor, then actually there could be, the family physician could direct accordingly and do the needful investigations and eventually refer to the oncologists for the needful tests, which could include imaging, which includes biopsy, and also certain endoscopies. So, or blood tests. So these group of tests, with these group of tests, and biopsy being the first and foremost one, this is how cancer can be diagnosed in such situations.
So we have advanced a lot medically over the years, and as you mentioned, the diagnosis of diseases are is now very frequent, so it's easy to catch on time. What is the status of underreported or underdiagnosed cases, cancer cases in India?
So we are just seeing the tip of the iceberg. That is for very sure, because still our society, there are a lot of cases, and because of several reasons, which some of which are known, some of which are still we need to unravel. Uh, a lot of cases might be going unnoticed. Certain reasons which are quite obvious is like the fear of the financial burden which might come, the fear of since it's more of a geriatric age group which could be getting involved, and so whether that age group is being looked upon in terms of are they getting the needful health facilities, are they being insured, covered in getting the needful insurances. So that those could be the challenges, and then there could be challenges related to certain myths. There could be challenges related to what would happen if I'm diagnosed, and what would be the implications for my children in terms of answering questions to the society. There could be several factors which are actually the cause of people not coming out at times. But things are improving, and conversations like this, what we are having right now, this is what is awareness, and probably the audience who would be actually listening to it must understand that knowing more about one's body, and any new changes happening, like what I mentioned, the red flag signs, and also proactively getting oneself screened, which we can discuss. Getting oneself screened could actually catch up certain early stage cancer, and there the cure rates are very high. It is very cost effective to treat at this particular point in early stage, and that's what I can say. That know about yourself, know about your body, get yourself screened. That's the best way to cure cancer.
Dr. Bajpai, in India, what are the various treatment options that are available for cancer, both early stages and late stages?
The various treatment options are basically there are several, but foremost, I would want to say that any cancer patient, before a treatment plan is laid down, the most important point is various doctors sit together from various disciplines, including pathology, radiology, medical oncology, surgeons, radiation oncologists. They all sit together and they make an algorithm, because the treatment journey is actually initially decided, and it makes a huge impact on how the uh, outcome of the patient would be if a proper algorithm is laid upfront. So this is very important. The treatment modalities, as you said, well, surgical modality is a very important modality for treating cancer patients. There have been advances from open surgeries to robotic surgeries. The surgical advances have taken place. Uh, Also, the what we used to say radical surgeries, as in big surgeries, are now getting smaller. We are trying to understand that such big surgeries might not be required. And a very important example is breast surgery, where earlier the mastectomy was the entire breast removal was considered safer, but then it has been realized now that one can go and preserve the breast and not have any increased rate of mortality or morbidity thereafter. So this is one surgical aspect. This is one improvement in surgical aspect. This is also called organ preserving strategy. Then talking about the radiation oncology, there have been improvements in delivering the dose of radiation to the right organ, to the right place, what one wants to deliver and giving higher doses and achieving better responses without causing toxicity to the nearby organs. This is more of a targeted radiotherapy, which there are several techniques for this, IGRT and IMRT. So there have been techniques. And then talking about the medical front, for which I can actually say that, being a medical oncologist, that there have been a lot of developments from the systemic, from in the field of systemic treatment. Chemotherapy was being used. It's still being used. And now what is there is understanding the cancer, understanding the patient biology in terms of looking at the genome of both the cancer and the patient, and then choosing your drug. So this is what is called targeted therapy. And then there is immunotherapy, which is coming up in a big way and has been promising. Immunotherapy is basically a drug which can actually enhance the immune system of the patient, and this immune system can actually fight against cancer. So there have been some really good results over the past 5-6 years, what we have seen in our practice. A combination of these is the way forward. Also, there are other therapies like stem cell therapy, which is bone marrow transplant. This is another important way to treat blood cancers. So these are certain ways that one can actually, implement. But what is important is making a upfront algorithm, multidisciplinary teamwork. These are certain ways to actually approach every patient.
Dr. Bajpai, like in India, whenever we talk about cancer, people tend to worry about the cost. It's always there. And also, in India, a lot of the majority of the healthcare expenditure is out of pocket. So do you think that this poses a challenge for, people to avail or assess advanced cancer treatment and therapies like immunotherapy and targeted therapies?
It does pose a challenge. I do agree. But the thing is that, as I said in our initial conversation, that a lot of cancers are, number one, preventable. Number two, that they can be detected in early stage. So breast cancer, after the age of 40, a lady does a mammogram regularly, annually. Likewise, for cervical cancer, a regular pap smear done after the age of 30 till the age of 65 every 3 years. And likewise, for heavy smokers, one can do a CT chest after the age of 50, as per the doctor's advice. And for prostate cancer and some other cancers, there are certain screening tests which, if followed, one can detect early stage cancer. And I said that early detection means higher cure rates and gratifying responses. And also, it is a very cost effective strategy in terms of cutting down on the costs. So this is what is important. And I think so that's one of the key messages I would want to give.
Dr. Bajpai, with every disease, there are certain types of myths. We saw a lot of myths with respect to COVID, and it's not just COVID, it's for cancer also and other diseases also. Would you like to debunk some common myths with respect to cancer for our viewers?
So I think so. We discussed one important one is that it is not a communicable disease, and that's one thing which a lot of people ask. And then there is a phobia regarding chemotherapy, which ladies come to me, and people do come to me. They say that hair loss would be permanent, and that's something that one must understand, that chemotherapy has a lot of reversible side effects. These all get better. There are side effects, but these all get better with the period of time. So hair loss is also one thing which there would be hair growth back again with after a certain period of time post stoppage of chemotherapy. And then there are myths as regards to food intake. I would suggest that during chemotherapy, food can be is just a good hygienic food that's required. Uh, it should be well cooked, and even refrigerated food one can actually have. And then there are myths as regards to radiation therapy in terms of they would leave scars, and so uh, there are certain side effects, but then the radiotherapy is one of the easier treatment to take. And then there are another important myth is that doing a biopsy one would spread cancer. So this is a very important thing and stops many patients from getting a biopsy done. So actually, biopsy is the way forward to diagnose every cancer and understanding the cancer in terms of looking at microscopically and then analyzing it to the genome. So biopsy is important and does not spread cancer. This has been proved in several millions of cases, which all over the globe they have been treated. Then there are myths as regards to cancer. It's like going to come for sure, and that's why this is one particular myth for which people do not take treatment. That once a cancer patient is there, so once diagnosed, it's going to be there forever. So again, as we discussed, that if one is diagnosed in early stage uh, situation, then the cure rates are actually very impressive and very high. So one would have gone through the treatment, and there are almost 70-80% chance above that one would be cured of it in certain cancers. So this is what I had to say. Of course, uh, there would be, so these things are there, and yeah.
Would you shed some light on how Indian cancer treatment and care has advanced over the years, and what are the challenges that still persist?
So Indian cancer treatment has advanced in terms of the uh, as I said, that there is awareness spreading, and therefore the people are now in the metropolitan cities realizing that cancer is not to be feared uh, upon, and one can actually get cured from this disease pattern. There's this awareness coming up. So that's one positive sign which we have seen, that people approaching and asking us about mammograms and vaccination, cervical cancer vaccination. So that's a very positive sign. As regards to your other part of the question was that
What are the challenges that still persist?
so challenges, as I mentioned, that we discussed that there are certain myths and the barriers uh, for people to come to the social system. There could be like uh, improper health insurance covers, or uh, the health system not available to their uh, uh, what they want. The resources are not there. So these could be certain challenges, and there could be challenges as we discussed about the myths. So these are certain things which we need to debunk and spread this awareness.
So, any word of advice for our viewers? What are the preventive steps they should take?
So preventive steps is what I would say, that adopt a healthy lifestyle, and uh, I would say that a regular screening is very important. Start screening earlier after discussing with the doctor if there has been a family history. So, in such situations, what I mentioned, certain age limits, I would say that we should start screening earlier in patients, in individuals with family history. And to prevent cancer, of course, there are certain vaccinations, especially cervical cancer vaccination is now there and is going to be very soon a part of the universal immunization policy. So that is one thing. So these are certain methods, and of course, screening tools for ladies, as I said, mammogram after the age of 40 years annually, and Pap smear, and now a cervical cancer screening kit is also available. Apart from this, for colon cancer after the age of 50 years, for both the sexes, one should consider colonoscopy once in 5 to 10 years. There is also a fecal occult blood stool examination, which needs a discussion. So both these tests should be discussed with the doctor. For patients, for males, basically, if there are any urinary symptoms after the age of 50 years, prostate cancer should be discussed with the doctor. Uh, for anybody who has been a tobacco chewer, at any visit to the doctor, one must get the oral mucosa, that is the oral lining, examined by the doctor whenever one is visiting. For any nagging cough or otherwise in chronic smokers, after the age of 50, they should discuss the possibility of lung cancer screening with their doctors. So these are certain cancers where screening can take place. And for family history, people with family history of cancer, they should discuss with their doctors about the possibility of doing a genetic test so that these genes can be detected, and certain prophylactic measures are there, including prophylactic surgeries, and otherwise, in some cases, adopting a very healthy lifestyle and medications, which can be started early, and they can, prevent development of cancer.
Anything else that you would like to add, sir?
So again, these sort of communications actually hopefully spread the awareness what we want in the society, and World Cancer Day is all about this. So hopefully that our audience would actually adopt a very healthy lifestyle and get themselves screened, and we'll be able to conquer this disease very soon with early detection, and this is the way forward. Yeah.
Thank you so much for joining us, Dr. Bajpai. It was really insightful. Thank you so much.
Thank you.